Well, good morning, everyone. I want to begin by thanking Tom for his kind introduction and to express my warm greetings from the White House. To those of you in the conference center, please know that I have you in my thoughts. It was a year ago, roughly around this time, when I had the pleasure of addressing the very first Health IT Summit in Southwest Virginia. This is a wonderful opportunity for those of us who care about this topic to understand not only what it means for us in the room, but how we in the room can engage the broader community, whether it be in rural Tennessee, Southwest Virginia, the other bordering communities, and beyond. It will be my intention this morning to provide for you a little bit of the context for why the topic of health IT is so critical at this moment in time. I also want to share with you very specific areas where I think we might want to collaborate to provide some context for work you all might want to do in the days, weeks, and months ahead. And then, last but not least, I look forward to ending my remarks with some larger lessons about what we do in the nation's spirit of economic recovery. First, let me welcome all of you to the White House. This is a broadcast from whitehouse.gov. What makes this a special broadcast is that while I'm speaking to you in Southwest Virginia, simultaneously we're speaking to all Americans. And it's an opportunity to have a conversation together, but to have one in a larger context. We have given you, I think, Tom, the instructions on how to tweet us with questions and thoughts you might have throughout the presentation at White House, if you could just use your Twitter feed. And I'll get to your questions at the end of my remarks. So let me begin with a little bit of a personal story. About a week and a half ago, I had the pleasure of traveling with the President to Troy, New York, a community where we visited a community college, a community that is preparing itself for success in the 21st century economy. We met firsthand with students of all ages who were thinking about the jobs of the future, surrounded by symbols of that future in the energy sector and the healthcare sector. The President laid out an ambitious innovation strategy. It is that strategy that I'd like to summarize for you as we talk about healthcare IT. The President outlined 3 areas of focus for the country, and it began with the economic stimulus package earlier this year. Many of you may or may not know that roughly $100 billion of the economic stimulus package was focused on innovation, long-term economic progress, the jobs of the future, whether that be investments in research and development, opportunities to spur training in our workforce, areas where we can catalyze innovation to advance our nation's priorities. We've made that down payment and have continued on that path in the months that followed. The President's strategy has 3 components. The first component is that we invest in the building blocks of innovation. For those of us in technology, we understand that the future rests in large part on our ability to produce that 21st century infrastructure. Those of you in Southwest Virginia and my friends know very well the importance of broadband, but even beyond our broadband investments, making sure that we continue to invest in basic research and development, and more importantly, that we lay the foundation for a vibrant workforce. I'll talk more about that in a minute, but let's talk a little bit about the broadband component. It is amazing to me, even in this time, that there are physicians, clinicians, patients, who still are not connected to the nation's 21st century infrastructure. All of the goals we'll be talking about throughout your conference and the conversations that we're having on health IT throughout the country rest on a very basic proposition that we will be digitally connected. So our first order of business is to make sure that we've got all of our providers, clinicians, and the ecosystem writ large connected in a manner that would allow us to build those innovative applications in healthcare IT. We're making an unprecedented investment through the economic stimulus package in broadband. I don't have news to share with you on the grants just yet, but we are hopeful in the coming weeks and months to announce the initial round of recipients for broadband stimulus funds, both from our Department of Agriculture and the Department of Commerce. While we focus on infrastructure from an investment standpoint, there's also a policy infrastructure question as well. And that is, how do we address the concerns of cybersecurity? And for those of us in the healthcare sector more specifically, how do we ensure patient privacy when our medical records are just a click away from access? These are very important policy considerations, and they go hand in hand with our concern around building blocks of innovation. I have been blessed with the opportunity to serve our President to think about how cybersecurity affects those of us in the healthcare sector, and more broadly, how we in the government can collaborate with the private sector to ensure we've strengthened our hand. Well, I'll talk about the workforce piece in building blocks because this is the most important question when I visit CEOs throughout the country, whether it be in healthcare or any other sector. You know, while we suffer from an economic difficulty in the nation, we still have over 2.5 million unfilled jobs, and there are sectors of the economy that are growing. Of every sector, of every CEO that I've had the pleasure of visiting, both in my capacity as Virginia's Technology Secretary, but now as White House Chief Technology Officer, ensuring that we have a highly skilled workforce has been the top request that we've heard from all of these executives. The President's heard them loud and clear. Earlier this year, the President made a bold statement that by the year 2020, the United States will once again lead the world in college participation rates, the share of our adult workforce that has a college degree. While we know we will have to get there by increasing our capacity through our high school students who move on to college, we believe strongly that a big section of that success will be built around our community college network throughout the country and our emerging tools like distance learning. In fact, the mechanism that we're using here today in the Higher Ed Center, it is this mechanism that we believe will help us to capture more and more of those minds so that America will once again return to a position it's had for a number of decades, but had fallen off most recently. Again, the share of our adult population has to return to #1 in the world. So these are the building blocks of innovation, and they are at the cornerstone of our innovation strategy. The second strategy is to understand that we are in a difficult time on a wide range of topics: climate change, ensuring that we have an educational system that works, and of course, making sure that we have a healthcare system that rewards prevention and wellness and cares for us and keeps us healthy, improving quality while lowering costs and obviously expanding access. These priorities, if you think about them, require new ideas for us to deliver on the promise. I can't tell you exactly what new iPhone app will hit the market that will convince me to reduce my intake on that grande vanilla non-fat latte that I seem to consume on a regular basis. But there are those that are building such innovations to make sure that we remain healthy and we keep focused with compliance on what our physicians tell us to do. All of these innovations, whether they be at the consumer level, the physician level, the hospital level, or as a community, all of these innovations are part and parcel of the President's second pillar to catalyze innovations against national priorities. What can we do? We can adopt standards that will promote a more vibrant innovation ecosystem. We can ensure that we're making research and development investments so that new ideas have the chance to see the light of day. We can even work with our own investments themselves, grants, and the purchase of technology from the government to help spur that innovation. I'll talk more about that momentarily, but making sure that we catalyze all of the innovation potential in this nation towards these priorities is a second pillar of the President's agenda. Third, and perhaps most appropriate for those of you at the Tech Council event, we must promote entrepreneurship. We must spur competitive markets in areas where we historically have seen difficult times. We see a wide range of areas that we can be effective. Historically, this has been the domain of how we protect intellectual property rights, but also balance our patent system so that it is more efficient and effective, clearing out the backlog and ensuring we're doing what works. But even beyond these principles, we've seen a new pillar in our entrepreneurship strategy. That pillar is to make sure that what we do in the government should be open to the American people. We've launched an unprecedented program on open government. In fact, it was the very first request the President made of the Office of the Chief Technology Officer on his first full day in office, calling for recommendations and eventually a directive that would ensure that throughout the federal government, our agencies would be hardwired for the accountability necessary to make sure that the default position in government is to be open. What data sets do we have in the federal government that, if made more accessible to the American people, could lead to better quality and outcomes? There are opportunities for entrepreneurship in ways we would never envision. Got a call from an entrepreneur the other day who said, gosh, clinicaltrials.gov is a wonderful website. It provides a lot of information about what clinical trials are available, but I can't get the inclusion and exclusion criteria in machine-readable format. And if you did, my little business could produce tremendous value by incorporating that inclusion criteria, exclusion criteria, so patients could literally, at a click of the mouse, figure out whether they qualify. Or physicians could run queries to see whom on their panel deserves the opportunity to participate. So these are just but some examples of ways in which we can spur entrepreneurship and new ideas through public policy, in particular, the President's Open Government Initiative. So this wide-ranging strategy of building blocks of innovation, catalyzing innovation towards national priorities, and focusing on the areas that spur entrepreneurship are all areas that we hope you as entrepreneurs and Tech Council attendees will take advantage of. But now a few minutes on the topic at hand and the issue of healthcare IT in this framework. I'm going to go back to each of these components to share with you what has been on my mind to see where you can take full advantage of the opportunities today. I began my comment around infrastructure, about the broadband needs that we have, but as well on the issue of security and privacy. We are actively developing the protocols, the standards, and the evaluation criteria to make sure that we are doing absolutely everything in our power to ensure the American people that as we move to this 21st century digital infrastructure, that we're doing so in a way that will provide them the greatest amount of control over their information on the internet. We have been working closely with the Federal Advisory Commission on the Health IT Policy Committee and the Health IT Standards Committee, where I have the pleasure of serving, to make sure that we've got input from the American people on what those standards should be. I would welcome your feedback. In just the coming days, we will be engaging the American people in more specific feedback, asking them to say, hey, here are the proposed recommendations for how we move our standards discussion forward. Specific standards around privacy and security, on ensuring we have a mechanism to review quality measures, specific ideas around what we're doing to ensure the efficiency of our clinical operations. All of the work of the Federal Advisory Commission to date, now we're moving to the position of asking about the adoption question. Are the technology standards recommended by the Federal Advisory Commission useful? Will you, the American people, see that these actually address the concerns you have? What tweaks should we be making moving forward? How do we create that continuous feedback loop so that we're doing everything we can, not just this month, but on a continuous basis in the years to come? We're going to be asking for your input in a more thoughtful way in the coming weeks, and I want you to keep your eye out because these issues of cybersecurity, patient privacy are top of mind to us. Second, in the area of catalyzing innovation for the nation's healthcare system, we've been following a basic framework. The most important framework has been to move out our healthcare stimulus investments. There are roughly $19 billion that we've made available through the provision of incentive payments through the Centers for Medicare and Medicaid Services, through regulations that we hope to publish by the end of this year. The two words that will mean the most to you in this conference and those of you who follow this issue, the regulations will center on the term meaningful use. It is our intention that when we make this investment around the nation's healthcare IT infrastructure, that we do so with the very basic idea in mind: how will technology spur the type of outcomes improvement that we want to see, whether that be to reduce the incidence of infant mortality, improving our capability to serve on heart care, on making sure that we keep people healthy who suffer from heart disease, making sure that we're doing what we can to manage chronic care, and a wide range of healthcare priorities that you and communities all around the country are going to be grappling with. We will have failed in this technology investment if we don't link all of this to ensure that in the communities where we serve, we're actually focusing on the eyes on the prize, improving those healthcare outcomes. So ensuring that we have an incentive framework, a meaningful use framework that speaks to the notion of healthcare outcomes will be a key priority as we work towards our regulations going forward. But while we await those activities for the incentive payments, we have two investment opportunities on the street, as they say right now. Through the Office of the National Coordinator, my dear friend, Dr. David Blumenthal, who's been a terrific leader on this issue, we have two active investment opportunities, over $1.2 billion worth in opportunity. Those who are applying for our regional extension centers, what I referred to as the Geek Squad for healthcare IT, making sure that the physicians out in the community have the support infrastructure they need so that when they transition from their current workflow to the digital environment, they're doing so with all the support and care they can get, not only from their own support services, but to pull the best practices from around the country. The second investment opportunity as we speak is the promotion of the state-based health information exchange programs. It's a real pleasure to have assets in Southwest Virginia like CareSpark and others throughout the country who are grappling with how do we ensure secure and stable infrastructure for the exchange of healthcare information. But we've asked states to work on strategies and have offered over $500 million in grants to help accelerate the adoption of those interoperability standards and to actually stand up the capacity to promote the exchange of data, again, with the goal in mind of improving healthcare outcomes. These are tools that we have in place in the stimulus package right now, investment opportunities that I hope many of you will consider availing yourselves of. But I want to broaden the discussion as we talk about the tools for catalyzing innovation on the national health IT agenda by talking a bit about the ideas that we don't normally talk about. How might our cell phones, mobile health as a model in general, help to spur new applications and ideas that will connect consumers to their healthcare information ecosystem? What are we going to do in the long-term research and development terrain to make sure that we're mining for what works in healthcare? You know, I was always struck by the following. If you think about the retailing industry, today, every single transaction in a retailing sector is managed, mined, and evaluated for best practice. The Redskins had a difficult loss this past weekend up here in the nation's capital. I can assure you that the retailing sector that includes Best Buy and Walmart and others knew exactly what promotion to run on Monday for us despondent Redskins fans to convince us to buy that plasma TV. They've mined their data and they've come up with strategies to ensure that they have an improved outcome, increasing retail sales. Ask that very same question of our healthcare system. What share of the nation's cancer population has their data in a repository akin to the retailing sector that can be mined so that we could identify what works and encourage that adoption of new applications and ideas to ensure that that information is in place not only for the patients but the providers who look to share for best practices? Less than 3% of the nation's cancer patients are enrolled in clinical trials. And really just those clinical trial enrollees have the opportunity to share that data through the National Institutes of Health CA BIG program. Less than 3%. 100% of your retailing transactions are evaluated for what works. But cancer, one of the most important topics for us in this country to grapple with, less than 3%, we can do better. As we set the foundation for research and development moving forward, I have high confidence that part of our economic and stimulus agenda with respect to health IT will incorporate the development of data infrastructure. We refer to this as the Comparative Effectiveness Research Program, nearly $1 billion focused on the opportunity. But there's more to come as we set forth the R&D agenda that's called for in the economic stimulus package. But I want to end with this more fundamental question. And that fundamental question is, what does this mean for you, for the entrepreneurs in this room? What is it that you can do to stimulate jobs now while we wait for these larger strategies to take hold? I'm going to leave you with 3 ideas. The first idea is the most obvious. I'm communicating to you in a distance environment. It's over the internet. And in a sense, I'm conducting business. I'm communicating with you in a speech that I would have loved to have done in person if my schedule would permit. How much work can be done remotely? Out there in Southwest Virginia, how many people could be trained to provide healthcare IT work to hospitals in Indiana, California, Florida, Northern Virginia? How much of the work that's been done in the healthcare IT sector that's growth can be remotely delivered? I think a great deal of it. What can you do in Southwest Virginia to ensure that you've got the training, the skills, and the capacity to connect to those remote opportunities? I remember that young lady in Galax, Virginia, who told me she's making a pretty healthy living despite the tough economic climate, working for a medical coding operation based in Indiana, and she's making a wonderful living in Galax, Virginia. Many more stories like hers will be heard in the months to come if we get this right. Second, the outcomes economy. As we look to make health reform a reality in this administration, one of the key lessons learned is how do we get the incentives right to deliver value? We have in the President's current fiscal 2010 budget a new strategy to bundle payments to providers to reduce what we refer to as the readmission rate. Patients who show up with chest pain at the hospital get treated, discharged, and a good number of them have to return to the hospital for repeat work. What can we do to reward health systems to invest in the kind of remote monitoring technologies that you'll be talking about later today so that we can monitor a patient's health in the comfort of their own home, making sure that if there's even the slightest hint that they're suffering a new problem, that we can intervene right then and there, perhaps address them through medications or through other dietary changes, avoiding the need for them to come back to the hospital for that costly, scary, and poor quality readmission. So we will create an ecosystem of the outcomes economy. And for you entrepreneurs out there to build the business case, to sell to those hospitals, to come up with plans so that your remote monitoring strategies can effectively deal with patient compliance and meet the needs of the hospitals. All of that now part and parcel of the President's strategy in respect to the introduced budget, but also the overall vision for health reform. But the final message I'll share with you and the opportunity that emerges today is that what we're referring to as the apps economy in healthcare IT. I had the pleasure yesterday of visiting with a number of entrepreneurs and academics in Boston, focusing on the development of a platform in healthcare IT, a platform that would be enabled by the provision of all of our stimulus investments. I hope, if effective, the deployment of standards that promote the open exchange of data with patient permission. If these platforms are real, and they come to fruition as we anticipate they will, all in the private sector and perhaps through public-private partnerships, imagine all of the innovative applications that entrepreneurs in Southwest Virginia and other parts of the country can develop. Ideas that we'd never even thought of. Ideas to connect you through your cable set-top box to a blood pressure check system so that you can keep your vitals checked and available to your clinician at a moment's notice. Ideas in the mobile health arena, as I outlined earlier, and ideas in areas that I hadn't even thought of, in data mining or ensuring that we're communicating what works as you engage on the difficulty of keeping your family healthy. This is the spirit of entrepreneurship and innovation. It's why the President had asked the Chief Technology Officer to focus on these issues. This is a top priority for President Obama. I appreciate the opportunity to engage with you this morning and look forward to your tweets and the opportunity to engage on questions. For Tom, thanks for having me. Look forward to getting together with you all soon. Now I'm going to turn to my buddy Rick to see if any of you had any questions.
Great. We have a few minutes for questions, Aneesh. First, can you say more about state interoperability standards?
Thank you for the question. There are essentially two initiatives that are taking place that should be important for those of you that are paying attention to where we are on standards. Number one, the Health IT Standards Committee is a federal advisory committee that's comprised of private sector leaders, academic leaders, government representatives, and I have the honor and privilege of serving in that body. We provide advice to the National Coordinator for Health IT in recommending the technical standards that should be adopted as part of our regulations in defining meaningful use. Now, what does that mean in practice? That means that at some point in the fall, perhaps in the December, January timeframe, but up to the regulators to determine how and when that's released, we will have a notice to the American people that says, if you wish to qualify for the incentive payments, the $19+ billion of incentive payments that we're making available, what you have to do as a clinician is to demonstrate that you're a meaningful user of a certified healthcare information technology product or service. There are two steps in that regard: certifying a product, and there are some regulations that we will include that describe how we wish to go about that certification process, and that you are a meaningful user. The recommendations that came out of the Public Advisory Committee were to focus those categories of meaningful use in three areas: improving clinical quality, driving efficiency in clinical operations, and ensuring the privacy and security for the American people of their healthcare information. These standards have now been developed in terms of a technical framework that is proposed to the administration. As I alluded to in my remarks, we intend to ask the American people for feedback on the adoption of these standards. Will it be easy? Will it be difficult? Do we need to modify them? Should we add new standards? That engagement process will launch at the last Health IT Standards meeting about 2 weeks ago. The chairman, John Perlin, announced that we'll establish an adoption working group, and I have the honor and privilege of chairing that effort. Separate from this work, which is going to affect the meaningful use regulation, we are offering grants to states to develop strategies to promote health information exchange. This was a hot topic for us in Virginia when I had the honor of serving as technology secretary. We've allowed the states to think about what works in their communities. States will be convening governance bodies, either state-run or through a designated entity, that would focus on the strategies that they believe will help to ensure data liquidity, for lack of a better term, in the healthcare marketplace. We enjoyed a number of strategies in Virginia where through CareSpark's leadership and in Northern Virginia, or I should say Richmond area, MedVirginia's work and the Northern Virginia RIO work, how do we work together through collaborative models to spur that health information exchange? There are other models. One of the initiatives we've had underway in the State Health Department in Virginia is to think of standards that would allow for the acceptance of advanced directives into the Department of Health. The technical standards and the model by which they would consume that information, a model left to the states. We hope they would adopt these national standards that are available, and they build the business models around the adoption of those standards. But how and in what format states will go about promoting exchange is an issue left to them through the grants process. We look to be very helpful in this regard and are confident that the foundation we will have left through the meaningful use definition would hopefully carry over with respect to the interoperability activities that the states will convene.
Aneesh, here's a tweet. What plan is in place for emergency providers to access electronic patient records in the field?
That's a great question, and I think, again, example of a question that would be appropriate at the state level to engage with respect to these governance questions. There are inherent questions of privacy and security with respect to how individuals access records with or without a patient's permission. I will assure you that it is important as you grapple with these questions within your health information exchange frameworks that you do so with the right framework in mind. We at the national level through the NHIN, the Nationwide Health Information Network, have been grappling with these use cases for years and have tried to work out legal agreements to enable providers in certain circumstances to, with patient permission and appropriate consent, access the records in use cases that are appropriate. This example of the emergency care provider wishing to access records is the kind of use case that we would envision the states developing around how they would like to see that type of consent delivered. Would the patient provide some kind of message to the clinician to say, you're allowed to see it, here's my login and ID so that you can access my personal health record? Would it be that you have a handshake between your primary care provider who has the freedom to release records to a referring physician under certain circumstances? These are the use cases that we hope states will continue to deliver and innovate around.
I think we have time for one more question. We have from one person, do you see a role for the federal government in going further with standards? And I'd add to that, because it's a common concern that comes up, standards with regard to patient privacy if these medical records are only going to be a click away. That's
a great question, and I will assure you that is the regulatory framework that we are in today. The Health IT Policy Committee and Health IT Standards Committee recommend to the administration the type of capabilities that we think all systems should have in place to ensure that we're protecting patient privacy. We may develop technical standards, modify, tweak, revise over time, but these are larger business model questions. What are the right methods by which you engage on patient consent? When I click on an online website and I accept their terms of service, embedded in those terms of service would be certain privacy considerations and the ability of that provider to share data. Does that model work in healthcare, and do we need to beef up our capability in that regard? These are exactly the kind of questions we will be grappling with through the adoption working group to see whether or not we need to modify what's been currently proposed under the security standards. Your input will be welcome when we ask for public input in this regard in the coming weeks, so please stay tuned. Thank you so much for the opportunity to speak with you this morning. Tom, you're my brother in arms. Thank you for having me. My good friends in Southwest Virginia, I wish I could have been with you in person, but again, in the spirit of technology and innovation, at least this gives us a chance to communicate. Please come visit, and I look forward to working with you in the months and years ahead to deliver on the President's promise for a modernized healthcare system built on a foundation of technology that would improve healthcare outcomes for our loved ones. Thank you, and have a great conference.